Today is World Obesity Day 2025, a powerful opportunity to spark real change. We're talking about the systems that shape our health, from healthcare and government to the food environments around us. Stay tuned as we explore why shifting the focus from individuals to these systems is key to a healthier future for all.
Hello, everyone. I'm Christopher Durham.
And I'm Laraine Durham. Welcome back to the Downsized. If you're new to our channel, please hit that like button, subscribe, and join us on our adventure. We share our experiences with GLP-1 medications like Zepbound, Mounjaro, and compounded tirzepatide. Christopher and I have lost over 150 pounds together on our adventure.
Before we begin, please remember that we are not doctors. Everything we share is based on our personal experiences and research. Always consult a healthcare professional before making any medical decisions. Today is a very important day, as Laraine said. It's World Obesity Day 2025. The day was created by the World Obesity Federation in collaboration with its global members. It's a unified day of action led by the World Obesity Federation, and this year's theme is Changing Systems, Healthier Lives.
What is the point of World Obesity Day? The mission of World Obesity Day, number one, is to increase awareness. Obesity is a disease. We are raising awareness and improving understanding of its root causes and the actions needed to address them. Number two is to encourage advocacy. Changing the way obesity is addressed across society, we're encouraging people to become advocates, standing up and calling for change. Number three is to improve policy. Creating a healthy environment that prioritizes obesity as a health issue, we're working to change policy to build the right support systems for the future. Number four is to share experiences. Stronger together, we're creating platforms to share experiences, inspiring and uniting a global community to work towards our common goal. We must work together to call for change to these systems, and people living with obesity must lead this call. We must also recognize obesity as a complex and chronic disease, and one that is also a driver of other diseases. Acting on obesity is a critical step in reducing the global burden of other chronic diseases, including diabetes, heart disease, and cancer. Together, governments, health professionals, and advocates, and you and I, can transform our systems and build a healthier future for people all over the world.
Numbers are staggering. By 2035, 1.9 billion people around the world will be living with obesity. The estimated global economic impact of obesity and overweight will reach $4.32 trillion. Childhood obesity is expected to double from 2020 to 2035, and 1 in 4 people will be living with obesity.
Let's put a spotlight on the systems, not people, that need to change. For too long, response to the obesity crisis have been focused on individuals. It's time we turn our attention to the systems that are failing us. Health systems, government systems, food systems, the media, and the environments we work and live in. All of these systems are contributing to the increasing rates of obesity around the world.
We need real change, and it has to come from all directions. Governments, health professionals, advocates, and the public must work together to transform these systems and create a healthier future for everyone. And we, the people living with obesity, need to lead this call for change. No single intervention can halt the rise of the growing obesity epidemic. Addressing obesity requires a comprehensive approach across all food and health systems, environments, and in wider society.
On this World Obesity Day, the World Obesity Federation is calling for action in health systems to recognize obesity as a disease and establish monitoring and surveillance systems to integrate and scale up obesity prevention and management services, focusing on primary health care, to include access to primary, secondary, and tertiary obesity services in insurance and universal health coverage packages, to resource and train the health workforce to deliver people-centered obesity care.
In the food systems, we're also calling for change, for stronger government regulation to reduce the consumption of unhealthy foods and beverages, including front-of-pack nutrition labeling and mandatory nutrition declarations, for actions to increase equitable access to healthy food across the life course, including protection, promotion, and support for breastfeeding, healthy public food procurement and service policies, reformulation of food and beverage products for healthy diets.
In our environments and wider society, we're calling for local governments to create public green spaces for active recreation and sport for people of all ages and abilities, transport systems to promote walking and cycling routes, fiscal measures to promote physical activity, for example, reduced tax on sporting goods and subsidies for extracurricular physical activity programs, employers to proactively address stigma around obesity and prioritize the health and well-being of all in the workplace, media to play an active role in addressing stigma and changing the narrative around obesity. Part of that change means challenging the status quo when it comes to the pharmaceutical industry. Too often, the focus has been on profit over patients. We need transparency, affordability, and a shift toward manufacturing and innovation that prioritizes patient health and well-being over maximizing profits. We believe companies can make a profit while ensuring patients have affordable access to life-saving treatments. Now is the time for groundbreaking public-private partnerships that focus on defeating the obesity epidemic. The system can and must change.
World Obesity Day is a chance to spark conversations and drive real change. By exploring the links between health, society, and the environments we live in, we can push for better solutions to address obesity. We must share knowledge, advocate for change, and challenge outdated narratives. Together, we can reshape the conversation and transform the systems driving obesity.
Continue to share our story and advocate for more treatment options, more accessibility, and more affordability for those living with obesity. To learn more about our personal journey of losing over 150 pounds, check out our other videos and subscribe to our channel here on YouTube.
Thank you so much for joining us today. If you found this video helpful, please share it with others. Let's spread the word and help push for the systemic changes needed to address the obesity crisis. I'm Christopher Durham.
I'm Laraine Durham.
And we are the Downsized. We'll see you next time.